Well, good afternoon, everybody. Welcome back to our Department of Labor and Economic Opportunity webinar series where we focus on workplace mental health. For those of you joining us for the first time, we kicked off this series in January and have had a great lineup so far, and we have a great lineup scheduled through the rest of the year. We do these monthly on the third Thursday of each month at 2 p.m., barring any changes to accommodate a speaker that we might have, because as I've shared before, our goal is quality over quantity. So we're trying to make sure we have the right information. And we want to make sure that we provide working people and employers with information about issues impacting our workplaces, the impacts to our mental health, and options for addressing these issues. As we've continued to develop this work, we definitely see three focus pillars kind of developing, with these being issues actually happening in our workplaces, which is what some of the things we'll hear about today. Trauma-informed pieces that we need to understand how societal impacts or impacts outside of our workplaces might either harm people or create challenges for people when they're interpreting different types of interactions. And then certainly individual behavioral health supports, because we know that we need those tools as well, and we are certainly underdeveloped in that space as well. And we're trying to line up these webinars around these pillars to make sure that we're spacing it out and talking about different issues that we can all incorporate into our lives and our workplaces to make them stronger. If you haven't already, please make sure you sign up for our emails at our michigan.gov/workplace mental health website. Right down at the bottom, there's a nice email sign up. We won't flood your inbox, I promise, but it'll get you all the information about the webinars we're doing and other information that comes up in between that we want to make sure that we can share out. There's a lot of other great links on there to resources, our State of Michigan Workplace Mental Health Report, a link to the Surgeon General's Mental Health and Wellness Report, and some other key resources there for you to check out. Now, in a couple of weeks, we're going to be in May, if you can believe it already, and that's Mental Health Awareness Month. And we have a solid lineup of additional webinars and in-person events we're going to be doing, so stay tuned. And if you're on that email list, you'll see those. We'll be talking about a host of issues, and we'll be collaborating with other parts of LEO and other parts of the state of Michigan, including the Michigan's Women's Commission and Michigan Rehabilitation Services. There's a Q&A box on your screen. On mine, it's on the top. I've heard from others, sometimes it's at the bottom. You can submit questions at any time throughout our presentation, and we'll try to get to as many as we can at the end. So we have an exciting presentation today. We have Dr. Michelle Kaminski, who's an organizational psychologist and an associate professor at MSU's School of Human Resources and Labor Relations, which is within their School of Social Sciences. Michelle is an expert on many issues in the workplace and how they affect our health and well-being, and works with working people and employers across the state of Michigan and beyond to find keys and tools to implement in our workplaces that can show improvements. Michelle has also served on the work group that developed our Michigan Workplace Mental Health Report and continues to be part of what I call the kitchen cabinet of experts that help me continue to develop, and our team at LEO continue to develop this work and move it forward. So at this point, I'll turn it over to you, Michelle, and then we'll come back to Q&A when you're finished.
So I'm really thrilled to be here today and to be working with Sean and this great group of folks at LEO on issues related to mental health in the workplace. And today I'm going to be talking about a couple of key things that cause stress and harm people's mental health in the workplace and what can be done about them. And the thing is, this is really a huge and vast topic, and we only have time to talk about a few of those things. So I'm going to talk about bullying and abusive supervision and understaffing as things that cause harm in the workplace. And I'm also going to talk about DEI issues. So feeling excluded and undervalued can be something that causes harm, and doing a good job on DEI issues can create a more positive culture and help promote mental well-being in the workplace. So I want to talk first about workplace bullying and a related topic, workplace abusive supervision. So one thing is, let me talk about what the definition of workplace bullying is a little bit. It is repeated health-harming mistreatment by one or more employees of another employee, and it can take the form of verbal abuse, threatening behavior, intimidation, threats of physical violence, humiliation, and in some cases work sabotage as well. And when I first started studying this topic, I was really surprised at just how prevalent this is in the workplace. People who witness it can experience harm, as well as the people who are the target of it. So what are the what are the consequences? Basically, the health effects include trouble sleeping, depression, anxiety, symptoms of post-traumatic stress disorder, and perhaps full-blown PTSD. And so there's a lot of negative consequence to the employees, but also there's a huge financial impact as well. It's a little hard to get a good number, but based on some research that was done for the International Labor Organization, based on some models in the UK, which has similar rates of bullying that we do in the US. If you translate that to the US, it comes to about $10 billion a year across the economy just for the cost of turnover and absenteeism. And that doesn't even take into account the cost of decreased quality and decreased productivity, which are much harder to measure. So the thing about bullying is that it's so common, but it's so hard to deal with for people in the workplace who might have responsibility for it. And among the reasons why it's so hard is that evidence and investigations are an issue, and that a lot of this happens between two individuals without other witnesses. So this is sort of like what we used to say about sexual harassment, kind of a he said, she said sort of thing. That's one of the reasons why it's so hard. It's hard to get evidence, and there are how offensive does the behavior have to be really bullying? Is it just a few comments? And we have seen things on the extreme end. I have heard of a case where a supervisor was suggesting that an employee commit suicide, and I think everybody would consider that wildly inappropriate and very extreme. And there's a whole range of stuff in the middle. So where do you draw the line? So it's hard to come up with good policies about this, but the other thing that's really makes it difficult to deal with is bullies tend to be more high ranking than their target. And oftentimes bullies, there's a particular type of bully who is very interested in climbing the organizational ladder, very politically savvy, and they tend to show a very kind, flattering, and good face to their superiors, to their bosses, but that's not necessarily how they treat the people who work for them. We call this kiss up, kick down. But the problem with it, one of the problems with this is that if you then go to the bosses and say, hey, this person is a bully, they just say, oh, that can't be. He's so nice. He's nice to me all the time. What do you mean? What are you talking about? And it can be hard for people to believe it. So those are among the problems in dealing with it. So what should we do about it? The first thing is to create a policy, and if you're in a unionized workplace, to consider adding it to your collective bargaining agreement. So for example, I'm going to quote from one machinist contract that defines prohibited harassment as conduct that has the purpose or effect of substantially interfering with an individual's work performance or creating an intimidating, hostile, or offensive working environment. So you can create some language. It's hard to create good language, but you can do that. And things that we recommend in general are that a policy should consider including a hierarchy of bad behaviors and the associated penalty. So if you say these kinds of things, this might be the kind of penalty you get. If you do this, then that's the penalty. And that's sort of like, for those of you from the union background, in the idea of just cause, that's like giving people notice that this behavior is unacceptable and what the consequences of this behavior is. And also it gives people a way to say the penalty is matched to is proportional to the offense, that a more minor offense has a more minor penalty, a more major offense has a more major penalty. Another thing is that people who are the targets of being bullied often really, they just want it to stop. So if they can be reassigned to a different part of the workplace, oftentimes they'll be happy with that. But that raises other issues. And so what I have on the screen here is consider reassigning the bully, not the target, which is a complicated and mixed kind of thing. On the one hand, you want to discipline the bully, not the target. There has to be a consequence. That consequence might be a reassignment, but on the other hand, many bullies are serial bullies and they're just going to start bullying somebody else in the new area. So it's kind of like kicking the can down the road. But what I would say to people who are in positions where they're expected to respond to this, it's hard to deal with. I know that, but also when we just look away, I think the best thing is what a quote from a colleague of mine, what you permit, you promote. So if the people in power just sort of turn their head and say, oh, well, not that big a deal, not that much of a problem, or we can't do it because this person's so important to us, then you're essentially saying we promote bullying and our organization is okay with it, and that sends a message to a lot of people. Another tactic that I find some success with is, which is only going to apply to some workplaces. There's no magic bullet for all workplaces, but if you can take away the face-to-face interactions between the bully and the target, so you say they have to interact by email, one of two things are going to happen. Either the bully's going to be just going to continue their behavior, in which case now you have a record, and now you can use that record to discipline the bully, or even better, the bully's smart enough to realize that, oh, now there's a record, so I better not say anything that's going to get me in trouble. And in that case, the bullying is actually reduced, so it can be a successful intervention. All right, next thing I want to go on to is understaffing. So a lot of the research that's been done on understaffing is in nursing, policing, and prisons. But since COVID, we know that the extent of understaffing has spread throughout the whole American workplace, and a survey by CNBC had half of all workers saying that their workplace is understaffed. So it's easy to see that this has negative consequences for employees in terms of stress and burnout. It leads to more turnover, it leads to lower productivity. It can harm the reputation of the organization because quality and productivity go down. There is one study that identifies increased cardiovascular risk among healthcare providers who work in hospitals that are understaffed. And I think the most compelling thing for me is the last thing I have on this list here, which is that 42% of Michigan nurses say they know of a patient who died because of understaffing, which is something that, so this to me highlights that understaffing, it affects the employees, it affects the organization, but it affects all of us as a society. The M&A has asked about that question on a number of surveys before, but this number is significantly higher than it used to be. So what do we do about understaffing? And this one, you know, there are kind of two answers. One is increase your staffing levels, and that is complicated because it takes more money to do that, obviously. People can think about different forms of staffing. So we often think about, you know, permanent full-time positions, but there are a lot of people who want part-time work and can't get it, and a lot of people who want remote work and can't get it. Again, depending on the workplace, some workplaces might have the options for temporary employees or for freelance employees. I don't know that that's gonna, because understaffing is very much an economic issue, and people will say they can't do it because of what their competitors are doing. People may also say that we try to hire people, but we can't. And as a labor person, what I would say in response is, if you're trying to hire people and you can't, or they're quitting, they're sending you a message that the characteristics of that job are not attractive enough compared to other jobs. It's either not enough pay or the working conditions are not good enough, and they're going to look for other options. So making the jobs better and making the jobs pay enough are both things that can attract people to the workplace. But if we can't hire more staff, another thing is to think about is, are there ways to promote, to redesign the work so that it decreases the strain on the employees? Is there a way to decrease the workload by eliminating less central tasks? Or is there a way to use technology perhaps that that makes the work less cumbersome? So next I want to start moving on and talking about DEI issues in the workplace, and I know we only have a couple minutes left. So one of the things I think of when I think about DEI is that the goals of DEI are for everyone to feel valued and respected at work. And when we talk about value, part of what we talk about is money. You can't feel valued if you know you're making less money than the person doing the same work in the office next to you. And so when I talk about DEI, I very often start with this chart, which shows the distribution of pay across the American workplace on average. And We know we have laws against discrimination by race, gender, religion, language, disability, bunch of other things. And yet we know we have pay discrimination in the workplace. So on this chart, this comes from the Bureau of Labor Statistics, and every January they put out this information for the previous year showing the median wages for all workers, which is that black horizontal line. So what I see when I look at this chart, two things jump out at me. First of all, we tend to think that white men are the highest paid group in the society, but that hasn't been true for a really long time. It's actually Asian men, and currently Asian women are for the first year making more money than white men on average, and we generally attribute this to a high concentration of well-educated Asians in the tech industry. But it is also the case that when we say Asian, that's a vast group coming from many different cultures and many different countries, and their experiences are not all high paid. So for example, an immigrant from Nepal probably makes a lot less money than this if they're doing something like working in a restaurant kitchen as a busboy or something like that. So huge variation, but those at the top are doing really, really well. The other thing that you'll see is that for all races and ethnicities, women make less than men. The average disparity is 82%, but unionized women make 90% of what unionized men do, and they make 100% of what non-union men do. Separate slide, I don't have that here. I know you know, those of you who are on this call are smart enough to know that this chart alone doesn't prove discrimination. You have to take into account what the job is, who the employer is, how much education they have, how much experience they have, etc. But even when you do those things, we find that there is still substantial differences in pay in the United States. So what are some things we also, I would say other issues related to discrimination in the workplace are things like microaggressions that take a psychological toll, and also things like having your contributions minimized, having no path to a promotion. And there's plenty of evidence that, excuse me, that exposure to discrimination increases anxiety and depression. And it's also the case that long-term exposure actually has a significant effect on your brain, and decreases cognitive functioning in the areas of planning and decision making. So long-term exposure to discrimination is very harmful.
Thanks for joining us, and thanks for your patience today, everybody. I will jump right into the first question and see if that's something that Sean might be able to answer while we're waiting to see if Michelle's audio is going to work for us today. Just a couple of notes. We've seen several questions come in wanting to know if this presentation, as well as the slide deck, since most of you haven't seen it, today will be shared. And yes, we will be emailing that out and sharing that to everybody who has signed up for our email updates. If you haven't already signed up for those email updates, check in the top of the Q&A here because the link for you to do so is there. All right, can you talk about how flexible work arrangements, for example, remote work, flexible hours, impact employees' mental health?
Okay, Sean, can you hear me?
Yes.
Okay, so I'll answer that. So we see a huge demand for flexible hours and remote work, and we see a lot more demand among employees than employers are able to accommodate. So I think it's helpful to people's mental health for some people, and I'm going to make some distinctions. So employees who are more established feel very comfortable with remote work. They've been around a while, they know their colleagues, they feel very comfortable with it, they appreciate it. Some want, some interaction once or twice a week face to face. Younger people just starting out often feel really harmed if their work is 100% remote because they feel like they can't form those relationships that they need to make with their coworkers. So in general, it's a good thing, but there might be particular people for whom it's not the best option.
And I would like to add just a little bit, Erica. So I hear in the work that we do with not only Michelle, but psychiatrists and others too, that the human connection is important. And while many of us consider ourselves to be introverts, there is some degree of interaction that we do need. And similarly to what Michelle said, and looking across the country at different surveys and other things, that sounds about right, that young workers getting established or newer workers trying to get established, those connections in person are more important. And a lot of it in discussions I have depends on the type of work that you do. If you're not really interacting very often anyway, then remote work obviously may make more sense, and you might be more apt and want to do that. But it sort of relates to that as well.
Perfect. Thank you both. Michelle, another question for you. One of our viewers would like to know if you or your team does this sort of development work for companies.
Yeah, but I have to be fair, though. There are other people in our mental health work group that do this work as well. So we do it here at MSU. The folks at the U of M do it. Lots of people do it. But if somebody wanted to talk to me about that, I'd be happy to talk to them.
Yeah, I think, Michelle, you had shared with me before that certainly on the survey, which is kind of part one of how we put out there for businesses to think about, that's something you shared that you've done a lot, right?
Right, and the part of the presentation that got cut out when I got disconnected again was that talking about surveys and how they can really help you improve your culture, but the single most important thing about the survey is what are you going to do with it when you find the results? What changes are you going to make? Because employees offer that information in the hope that it's going to make things better. And so that, I think, is the thing that needs to have a lot of planning in advance. What are you willing to do? And if you're not willing to do any changes, then I'm not sure it's worth doing a survey. But the surveys can absolutely help you understand what the problems are and where the problems are, because especially in a large organization, it's not homogeneous, and there are going to be difficulties in certain areas, certain maybe job classifications, or maybe with certain demographic groups or certain shifts, or whatever the case may be. The survey information can help you figure that out. And then the question is going to be, what are you going to do about it?
Perfect. Well, we have time for one last question, and so I will close out with this. Are there any employee-focused sessions around mental health, and what resources are we able to provide as a support system to staff?
Can you clarify the first part of that again?
Yeah, just looking for any employee-focused sessions around mental health.
So is that a question for Sean?
I would say to either of you, if you're aware of resources, webinars, events, that sort of thing, okay, feel free to share.
So there are several resources listed on our resource hub, and some other tools there. Next month, when we have Staywell as our guest, they're going to share some of the things that they're launching from our Michigan Department of Health and Human Services that are focused in that way. But importantly, when we talk about workplace mental health, part of this is about systems, right? And that we're going to need sort of top to bottom awareness, understanding, and maybe even changes to make sure that we have the right framework to support mental health in an ongoing way. But recognizing the question, of course, there are tools that we have available or can make available, and things that are already listed on our resource hub that can help us deal with and manage the stress that we have in our workplaces, in our lives, and find better outcomes. So they're definitely out there. We definitely have some available, and we're going to continue to grow that space as well. And with that, we're at time. Unfortunately, whatever was going on in the tech world today was not very conducive to our great guest, Michelle Kaminski. You all got a few minutes there to hear from her and see how great she is. We definitely will be posting the webinar, but the slides as well, to make sure that you have those so that you can filter through that information. I appreciate you all joining us today, and I look forward to seeing you at our next webinar. Thank you so much.